As a first responder, you will sometimes be required to lift, move, or position patients and assist other EMS providers in moving patients and preparing them for transport. Usually, you treat the patient in the position found and later help other EMS personnel with moving the patient. The most common move you will make is to simply place the patient in the recovery position to maintain an open airway. Let's review how to do it. Roll the patient onto one side while supporting the head. Place the head so that any secretions will drain out of the mouth. The patient's hand can help hold the head in a position which will help keep the tongue and lower jaw from blocking the airway.
In some cases, you may have to move patients to a different location for their own protection. Every time you move a patient, keep the following general guidelines in mind.
Do no further harm to the patient. Move the patient only when necessary. Move the patient as little as possible. Move the patient's body as a unit. Use proper lifting and moving techniques to assure your own safety. And have one rescuer give commands when 2 or more people are moving a patient.
The 2 basic ways of moving patients to safety are the emergency drag and the patient carry. There are several types of emergency patient drags. The clothes drag, where you grab the clothes while stabilizing the patient's head with your arms. The blanket drag, which protects the patient from rough ground and also enables you to move heavier people. The arm-to-arm drag, which is also useful for heavy patients and offers some protection for the head and neck.
When performing an emergency drag, always remember to make every effort to pull the patient in the direction of the long axis of the body. That will provide as much spinal protection as possible. Patient carry should only be performed if you are sure that no spine or neck injury has occurred. There are many different types of patient carries.
The pack strap carry, a one-person carry which works best when the patient's armpits rest on your shoulders.
The direct ground lift, which requires lifting from a kneeling position and should be avoided if possible because it strains the lifter's backs.
Many lifts and moves are done without any specialized equipment. There are, however, several transportation devices that EMS providers use which you should be familiar with. These include the wheeled ambulance stretcher, portable stretcher, stair chair, long and short backboards, and scoop stretcher. Refer to your textbook for more details on how to safely transport patients. It's also worth remembering that in auto accidents, you may find young children in car seats. If they are properly restrained and the seat isn't damaged, leave them in the seat for transport to the hospital. You can immobilize and stabilize them with towels or other available materials.